guys, you all have been asking me to do a video talking about the new prescription topical retinoid Trifarotene, which goes by the brand name Aklief. Retinoids and topical vitamin A derivatives like retinol and retinaldehyde are indicated for acne because they can help make the skin cells less sticky and less prone to plugging up the pore, leading to comedo formation. They can actually reduce the formation of pre-acne lesions called microcomedones, and they are anti-inflammatory, and they just help the skin turn over better, which is a major problem in acne. These vitamin A derivatives also have a variety of other skin benefits, including removing sun-damaged skin cells. They can boost up collagen production in the deeper layers of the skin, so they have an anti-aging benefit as well. And in dermatology, we use them for many skin conditions, and we do so in what is called doing so off-label, meaning they're not approved for those conditions, but we know they work, and so we prescribe them for those things. But anyways, what is Trifarotene? Well, it's a new prescription vitamin A derivative, new prescription retinoid. Now, it's a little different from the other ones. It's different because here's the thing: retinoids work by binding to certain receptors, and all the other retinoids on the market and vitamin A derivatives, they're not that precise binding to just the retinoid receptors that are important for the skin, which is the gamma receptor, GAMMA. Most bind to both beta and gamma. However, Trifarotene only binds to gamma. Not only that, Trifarotene is metabolized a lot more expeditiously, and so it doesn't hang around as much to cause as many side effects. And when I say it doesn't hang around as long, that doesn't mean that it doesn't work as long. The topical retinoids, once you apply them, they get to the cell, they bind to the receptor, and once they bound to the receptor, they do their thing. But it's helpful for them to be metabolized very quickly and go away so that there's none lingering out to have off-target effects. So that's an advantage of Trifarotene over the others on the market. But another really unique feature of Trifarotene that is appealing is basically the way that the clinical studies were set up to examine efficacy of Trifarotene. The clinical studies didn't just look at efficacy of Trifarotene for acne on the face, but they also looked at efficacy of Trifarotene for acne on the trunk, like the back, for example. And so these studies showed that Trifarotene is effective for both acne on the face as well as the trunk. And you may be wondering, is this the first retinoid to be effective for acne on the trunk? No, but it's the first that has been clinically studied and is approved for acne on the trunk. In other words, I have been prescribing retinoids off-label for acne on the trunk for years and find that they're very effective. Okay, what about how effective is Trifarotene? It's actually very effective and seems to yield results faster than other prescription retinoids. That being said, we don't have any studies comparing Trifarotene to any other retinoids side by side. We just have studies looking at the efficacy and tolerability of Trifarotene in comparison to vehicle alone. And when I say vehicle alone, I mean if you take Aklief and you remove the Trifarotene from it, you've got some other ingredients in there. So those other ingredients are what are referred to as the vehicle, and that is what Trifarotene was compared to, the vehicle. So the cream without the active ingredient in there. But not only is Trifarotene effective, it seems to be effective pretty quickly. In clinical studies, there was improvement in lesions on the face in as early as 1 week. That's pretty good. Usually, we don't see that with other retinoids. They take a while to work. So it seems to be faster. As early as 1 week for the face and as early as 2 weeks for the trunk. And so that's good. It seems as though it takes a little bit less time to start seeing results. So you get results pretty quickly with Trifarotene, which is good because that helps with compliance of the medication. Patients tend to get frustrated with things that take a long time to work, and they tend to stop using things if they don't work fast enough. and it can be hard to stay motivated to continue to use a prescription if it's not working right away. But in the studies and with use, it seems as though patients do have some side effects that are typical with retinoids: dryness, irritation, peeling, and redness. The side effects peak on the face at around 1 week, are even less so on the body, on the trunk. So the side effects seem to be more so on the face, but they tend to subside after 3 months and overall are very mild to moderate. And so it does seem like it is a lot less irritating than tretinoin, for example. But again, we don't have studies necessarily comparing the two and, you know, comparing the level of irritation between the two side by side. But as of now, it really does seem like Trifarotene is a lot less irritating. And it's nice to have something that's approved for acne on the trunk. We really didn't have a retinoid that was. So it's nice that we have data showing that it's effective for acne on the trunk, because a lot of young people deal with acne on the trunk in particular. And when I say young people, I'm talking about adolescents and teenagers, but that's not to say that this medication is not going to be helpful for older adults with acne. One question you guys will want to know is, well, how does this compare to tretinoin for anti-aging? We can't give you that information. It's brand new. So, you know, if it reversed anti-aging at this point in its lifespan, given how new it is, that would be remarkable. So I can't tell you, but logic follows that yes, it likely is going to have the same anti-aging benefits. There's no reason to believe that it would not. But I can't like cite a paper on that because it was, you know, it's brand new. So it's exciting to have a new vitamin A derivative in our armamentarium for treating acne and other skin conditions. You know, I look forward to having more experience with it. It is pretty new, but it's good to know that this is something that can potentially work faster, have fewer side effects, and be used for acne on the trunk. But you'll find that all of the recommendations that we give for Retin-A or tretinoin or over-the-counter adapalene are still hold true with Trifarotene. Even though it's new and a 4th generation retinoid, you still have to be careful not to use a lot of irritating skincare products. They can potentially compromise the efficacy of the Trifarotene, set you up for more irritation and problems. And it's advised that you be very careful when you go out in the sun. That was one of the adverse side effects actually in the clinical studies, was increased sunburn. So you need to make sure you're protecting your skin from ultraviolet radiation if you're on this. I mean, everybody should be protecting their skin from UV. That includes wearing a broad spectrum sunscreen, not staying outdoors without sun protection on, and, you know, wearing a hat and being really safe in the sun because you are at greater risk for a sunburn with this medication. Also, it's recommended and advised that you avoid any depilatory creams or waxing, plucking, shaving while using this, because you'll find that your skin becomes hyper irritable to stuff like that, and that can actually give you worsening acne potentially and rashes and things like that. I always get a lot of questions about purging and the worsening of acne. That actually wasn't reported in the clinical studies on Trifarotene. It is something that we see sometimes, and I have a video talking about purging with Retin-A. It is something that we see sometimes early on, but it really is not a problem long-term. And more often than not, if somebody's acne is getting much worse while they're on a vitamin A derivative, it's usually because either they're using a bunch of other skincare products that are irritating, or the medication is just too irritating. We didn't see in the clinical studies anybody's acne worsening, but it's not to say that it can't happen, but it seems lower risk with this, given that it has fewer side effects of dryness and irritation and whatnot. So that's promising. And another reason why teenagers and young people would be more excited and motivated to continue using it. That is a real stumbling block with prescription retinoids, is getting over that initial dryness, irritation, and the few cases where you do have flaring and worsening and purging of the acne as I describe it, but it's really just an irritant dermatitis. Those situations, people are like, I don't want to keep using this, and they bail on their prescription medication. So that's a nice thing about this, is that it kind of is removing some of those barriers to compliance. But it's not completely side effect free. You will still experience side effects of dryness, peeling, Also in the clinical studies, a lot of people reported itch, the sensation, you know, having itch. Just scratch my head as I say that. Having itch with using trifarotene, but the side effects seem to be much milder in comparison to other vitamin A derivatives like tretinoin. But again, not side-by-side comparison in any of the studies, it just seems that way. But comment below, and if any of you guys have started using it or been prescribed this, how it's been working for you. And I hope this video was useful to you. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.